Good morning, good afternoon, and good evening all over the world, you beautiful brave hearts. My name is Dr. Darrell Wolfe, and today we're going to be talking about our feet, okay? All right? So here's the deal. Most people never think about their feet until they get home, and their feet are so aching and tired, okay? Now, if you've got chronically sore feet all the time, just know this, that your nerve endings all end in your feet. Now that means all the different organs and all the different systems in your body, the nerve endings end in the feet. So when you've got chronic fatigue, when you haven't drank enough structured water, okay, for a man it would be 4 to 5 quarts, for a woman it would be 3 to 4 quarts. Yes, that's right. You want to drink 3 ounces of structured water for every pound that you weigh. And we used to do a half an ounce, but now we got to go to 3/4 of an ounce because of all the 5G, all of the blue light, and all of the extra toxicity that they're throwing at us. Isn't this fun that we come down to this planet and the people that we call authority are actually trying to poison us? Whoa, I've never played such a fun-filled game in my whole infinity life. How's that? Anyway, so here's the deal. We're going to talk about your feet. Now, when your feet are really in pain and you're tired, guess what? There's nothing better than using peppermint oil. That's probably the best oil you could use. So what you're going to do is you're going to take about, our peppermint oil, all of our oils are pure. They're all concentrated. They really are. When I go to bed at night, even if my feet are not tired or sore, okay, I always do about 6 to 8 drops of peppermint oil, and I rub it on the bottom of my feet. If I do it at nighttime, believe it or not, I'm telling you, when I forget, I don't fall asleep as nice, but when I do it on my feet at nighttime, it helps to calm you down. And when you put the peppermint oil on, 6 to 8 drops, you could do more. It's not going to hurt you, okay? And you don't need a carrier oil. You just need to do it straight. When you put that on the bottom of your feet in the morning, it's going to stimulate you, get you going, makes you feel, it activates you. And at night, it calms you down, okay? All right? Now, those of you that in the morning, when you can actually put your shoes on, and by nighttime, your shoes are tight, that's because, guess what? You don't have a lot of energy. You're getting tired really quick because you don't eat right and you don't drink right. You don't basically live right. Most people don't. I'm not trying to put you down. You can't do better till you know better, and I'm trying to be here so maybe we could know better to do better, right? Now, when your feet swell, you do know that's water retention. When your feet swell, you do know that your immune system is under attack because you have so much infection that you've got all this inflammation. And then with the inflammation, what are we going to do? The first part of the word inflammation is inflame. And when there's a flame, we're going to call the fire truck, and we're going to bring the water to dilute the poisons and cool the area down. So your feet are actually swelling because they're on fire. You're exhausted, and you probably didn't drink enough water. The big problem is people just don't drink enough water. Now take a look at my feet. Take a good close look at my feet, okay? Now, don't get me wrong, I'm not trying to tell you I've got the most beautiful feet in the world, but I am trying to tell you that for a guy who's 67 years old, these do not look like 67-year-old feet. There's no wrinkles in these feet. I've got a couple little ones on my toes, but nothing that you can see. But I have where's all the wrinkles? Where's all the old age? And then with most people, when they get up around the age of 40, 50, guess what? They start getting their joints start to get knobby looking, and then in here you see how it looks dehydrated. These are called lymph channels. In between all the way up to here, you see these deep lines. That's dehydration and scar tissue formation and calcification. Understand something. Most people, by the time they're 60 years old, these are cement blocks. Cement, I'm telling you the truth, okay, that's calcification. And guess what? Your feet calcify. And a lot of people, when they're older, they trip over their own feet. And that's because right here it's called, we call this the horseshoe in the ankle. And right in here, this is called the eye of the ankle. Now, if I take, and I'm going to show you, I'm going to go in here And go get yourself an eyedropper bottle or something. I'm using an IGF bottle, IGF 300,000 bottle, and I'm gonna hold it, and you see the edge of the bottle? See the bottom edge? Look at the edge all around here. Well, I'm just gonna use the edge, and I'm gonna hold it like this. You see how I'm holding it? Okay? And I'm gonna use an action and like this where I go in. Let me do it sideways. Okay, so when I go in here, can you see it? I don't know if you can see it, yeah. So when I go in here, let me do it this way. So when I go in here, I'm actually gonna go and use this. See how I'm going in here and I'm kind of using the edge? And I'm gonna use this kind of action. You see? Here's the action I use, okay? So let me turn back around. So the action I use is gonna be like this. When I go towards myself, I'm digging in. When I come back, I'm just sliding along the skin or it's off the skin. And then when I come back in, and you're gonna make small movements and you're gonna go deep. Let me tell you something right now. If you knew what I knew, you would not age. Oh yeah, you're gonna get older, but you're not gonna age where you're gonna get up and stiff and walk around and not sure about your balance, your alignment, you know. And then you go to these guys who are supposed to be foot specialists, and then what are they gonna do? They're gonna make you insoles because they say that you're out of balance or your arch is falling. You know, these guys are so full of BS. They will sell you till the cows come home. If I could teach you how to do Wolf non-surgical and go in there and actually melt the crystallization, open up the scar tissue formation, if I could get you to take CIT, okay, which is calcium ion therapy, we could get all the calcium that you've lost out of your bones that gave you osteopenia, osteoarthritis, or gave you arthritis. Because understand, arthritis is just calcium and scar tissue in your joints. Are you with me? Arthritis, inflammation of the joint, and calcification of the joint, scar tissue formation of the joint. You know what? They're gonna talk over your head. They're gonna make you feel stupid. Arthritis, fibromyalgia, that just means pain in the muscle fibers. Chronic fatigue just means you've been backing up your bowels so long that you've actually backed it up into your liver, and you've also, you're a terrorist to yourself, and you've been hitting on your adrenals continually, so your adrenals are flat, okay? You're not depressed, and you don't have a thyroid problem unless you're a terrorist, okay? So understand something, all depression is caused from anxiety, and anxiety is caused from you telling the same terrifying story. So this will be really good for you this time of year, because now you can go watch all these horror movies at the show or on TV so that you can just stress yourself out more. You know what? You are the story you tell. And I'm telling you right now, the stories that you tell are all cooked up in hell, and they're given to you and they're force fed. And understand, there is no authority over me. I'm not going to get into that today, but there's no authority. I tell my own story, and it's a glory story where I am the Braveheart hero in the present moment, and I own it, okay? And everything else is just BS, a dysfunctional belief system. So understand, whether you're talking about a bunion on your foot, and a bunion on your foot, everyone, is scar tissue and displaced calcium. Go figure. Now, Lori, who is my partner, what we did was, okay, is I went in and I did non-surgical, and we used the bottom of the bottle, this bottle, going into the bunion, and I went in really hard, okay? And I tried to break it up as much as I could. Then I did Wolf non-surgical around the area using my elbow. But then you know what the ticket was? Every night before she'd go to bed, she would take our DMSO gel, which is made from pine trees. It's a solvent. It'll go in the DMSO. It'll carry other things in with it. So whatever you do mix with the DMSO, make sure it's pure. But she would take the DMSO, and then she would take what? She would take our frankincense or our pain away, and she would mix that with it, and just a couple of drops of our C60, and just a couple of drops of our fulvic acid nano bright eyes. Now, just a couple drops of these things. And then she'd take a little bit of DMSO gel, and look at the DMSO gel here. Give me 1 second. It's clear, see? It's just clear gel. And look at this, I want to show you something. You know what? It's so cheap. for how long it's going to last you. I want to show you this. Now for a bunion, I would use that much. Look at this. Look at that, guys. Look at that for a bunion. You can't even hardly see it, just the end of my finger. And then I would put it, and I would mix just a couple of drops of frankincense, or I would mix, or if the bunion was painful, I would maybe mix peppermint with the DMSO. And I mean, if it was really painful, if it was, and if not, then, and you wanted to go a cheaper way, go with the Pain Away essential oil, just a couple drops, and then a couple drops of the Bright Eyes, and then a couple drops of the C60. Now, if you can't afford these things, I get it. Just use the DMSO. We're not leaving anybody behind here, okay? So then what I want you to do is you're just gonna get yourself a little round Band-Aid. You know, you ever see those little wart Band-Aids? Well, if you get yourself a little round Band-Aid and then you cover that with the DMSO and you put the other things I just said, you know, you can mix up a jar of this and then have it. So you're gonna put that little goop on the Band-Aid, and then you're gonna put that on the bunion, and then you're gonna leave that sit there all night, okay? Now, here's what's gonna happen after about 7 to 10 days. You leave it on all night, and then in the morning, if you want, you can take it off, or you could put a fresh one on and leave it on all day. Let's punch it, punch it, punch it, punch it. Let me tell you something right now, and you gotta get this. Most practitioners are not going to front end load you. What does front end loading mean? Let me tell you something right now. Practitioners mean well, they really do. But you know what? If you got a 20-foot hole, I got to give you a 20-foot ladder. I'm going to give you the nutraceuticals, and I'm going to front end load you on those for 6 weeks to 3 months. I'm going to make you do your external therapies no less than 3 times a day, right? We're going to hit 3 times to 6 times a day. So, you know, somebody else is going to say, well, rub a little bit of DMSO on that bunion there. Oh, whatever. It's going to take the pain down a little bit. But, you know, we got to go hardcore. And you're going to understand something. Big Pharma is going to tell you DMSO is toxic, and it's not. It's made from pine trees. If you were to use DMSO and then put poison mixed it with it and then put it on your skin, well, of course, please. Logic. We need it. Now, so take that Band-Aid, put that Band-Aid on before you go to bed, then change it in the morning and do it again. I'm going to tell you something. I think it took like 3 weeks for Lori. It was a huge bunion, okay? And guess what? The thing was filled up with water. That's right, after that, it just became water. But what we did was, every few days we'd go in and she'd work with it and do the bottle work, which I'm gonna show you, or I do a little bit of non-surgical on it, okay? All right, so anybody can do this. But guess what? If you don't have enough, most people don't have enough love for themselves to follow through with hardly anything. When it comes to their family and everyone else, they would give the shirt off their back, they'll do anything. But when it comes to yourself, you've been so brainwashed by religion, not all religion, but most of it, and by government, and by just everybody who ruled, schooled, and fooled you all the way from the time you got here until now, okay, that if you actually went in there and created the life that you wanted, everybody would consider that a selfish act, when actually it would be a centering into yourself and giving yourself what you bloody well need, okay? I am never going to take advice from anybody for anything, and everything out there is a bloody lie, so just know that, okay? And even the people that care and love me, they don't even know the truth, because until you are totally unconditionally love and care for yourself, you're never gonna do what you need, and you're definitely not gonna share that with anyone else, because that's a selfish act. So let me tell you, I will never follow 99.9% of the population because they're going off the cliff. There, I got that off my chest. I feel a heck of a lot better. Now, here we go. Here we go. You ready? Got your bottle? Go get an eyedropper bottle. Okay, this is an IGF 300,000. You could use a Bright Eyes bottle. You could use a C60 bottle. They all come this small. Just make sure they have a bit of an edge on them on the bottom. And the edge is the key. That gives you the edge. Let me tell you something. You want to go to a massage therapist, you're going nowhere. You want to go to a Wolf non-surgical therapist, we'll give you a money back guarantee. We're going to bring the lightning down. We're going to bring the thunder down. Okay? So let's do this. So right off the bat, it's how you hold it. Now, see how I did it with this one? You don't have to do it this way. Do it any way you want. But for me, that's the grip I like, right? You see? And then what I'm going to do is, let me show you here on my hand. So these are my toes. Okay, And then this would be, and then this is the back of my foot, right? Just behind my toes. These are called lymph channels, everyone. And if you take a look at people, you know, usually they dehydrate and you've got these deep lines here in between your, all the way back, and everything looks bony and dry. That's what old people are, right? They're bony and dry, okay? Okay, because they don't know how to look after themselves and it's not their fault. All right, so the older you get, the drier you get. So that's why the older you get, the more you eat whole plant-based foods. You need more enzymes, you need more minerals, okay? You need more fiber, you need more water. Do you get this? So the more you cook, the worse you look, the more you fry, the sooner you die. Are you getting it? Okay, so tea and toast is not gonna cut it, anybody, okay? And you've got to change the rules, okay? You've got to change the rules. Now, here we go. So what we're gonna do, the first thing I'm gonna do before I work on my toes is I'm gonna work in between my toes. These are called lymph channels right here. These are called lymph channels. When I'm working here all the way back to my ankle, these lymph channels, I'm actually improving my lymph. Did you know that I told you that all your nerve endings end in the feet? So that's why if you exhaust yourself or you dehydrate yourself or you don't eat properly, your feet are gonna pound, they're gonna ache, they're gonna feel tired. And nobody's going to help you, so do all you want, but you know, get the peppermint on there before you go to bed, at least 8 to 10 drops, and rub it on the bottom of your feet, and then do it again when you wake up in the morning to stimulate yourself, to get yourself going, okay? Now, I just put some C60 coconut oil on, which is the best that you could put on, but you could just put coconut oil on if you wanted. Okay, coconut oil is enough. You don't use olive oil or other oils. Just get some coconut oil and then rub that on your foot. So what you're gonna do, you're gonna come to, let's just take the baby toe, and I'm gonna come in here. See how I'm going up with the edge? Okay? And guess what? A lot of you, when you go in here, it's gonna feel like beef jerky and crystals. And that's because, guess what? You're not hydrated and you just never do this work. Like when I'm in Mexico, I live in Ixtapa, Mexico, and I also live in Puerto Rico. And believe it or not, in Puerto Rico, I'm a block and a half from the beach. In Mexico, I'm about a 4-minute drive from the beach. But when I'm there, I do what's called a sand scrub. And understand, all I do is go on the beach. And next time at a beach, I'll show you. And I usually do it every place I go to. So I do a sand scrub. And if you were to scrub your body every day, if you were to go to the beach and scrub your body as hard as you could, your face, your breasts, your butt, your arms, your feet, everything, you'd have no wrinkles. You'd have more collagen. You'd have more elastin. You'd move the lymph. You'd move your circulation. You'd feel young. Wow, wouldn't want to do that. Okay, but if you're caught in the city, which is a pity because that's not where you want to be when the elite are starting to target the cities. Well, where else would they target? Anyways, what you can do is go to Costco, get a 10-pounder of Epsom salts, put it into a Tupperware container, pour the Epsom salts in, wet it down to the consistency of wet sand, okay? And then what you're gonna do is if you have essential oils, right, like this is frankincense, okay? All right, you can put frankincense in or lavender or put any essential oils in that you like. I mean, I like putting Muscle Restore in mine, and then I put enough in there that I can smell it, okay? Then what you do, if you're at the beach, you just pick up the wet sand and you scrub your whole body. You go and you scrub all your joints, every joint. You go in and scrub every joint. Oh, lucky me, we got somebody doing the lawnmower. I don't know how long that's gonna last, but I'll speak loud. So anyways, so now the Epsom salts, you can do it at home. If you do the Epsom salts, you wet it down to the consistency of sand. You get you know those white stools, you sit in the shower, and what you're gonna do is sit in the shower and you're gonna start with your feet. So you pick up the Epsom salts, and then what you do is you really scrub hard, and you scrub your toes, you scrub every joint. You scrub at the edge, everywhere. And when it comes to things like your knees, you would take the Epsom salts in the shower or the sand, and what do? You scrub hard, and you scrub like this. You really scrub. You scrub the back of your lymph nodes. You really work it. Really work it, guys. Really work it. Like, work it like you mean it. I mean, even scrub your face fairly hard, your neck, everywhere in your body. Get in there and scrub. Look at, why pay somebody hundreds or thousands of dollars when you can do this at home for yourself? And if you go into my book, Healthy to 100, it's in my library at docofdetoxlibrary.com, or just go to Doc of Detox, click on library. At the back it says beautiful skin. Go look at the things you can do. How you can get rid of cellulite by using the Epsom salt cayenne scrub. How you can do Epsom salt cocoa scrub and then scrub your whole body. And when you get out, you'll be moisturized already. And you won't look like a dry old prune. Okay, understand something. People say to me, oh, what do you do, Dr. Wolf? If you look at it, well, you must be doing something, you know. No, I do what I tell you to do. And it's all about circulation. It's all about elasticity. It's all about longevity. And you're not going to have longevity without circulation. And the better your circulation, the better you're going to be, okay? So I'll speak as loud as I can. My timing's off today, as you can tell. Okay, so here we go. So I told you what to do with the bunion. Let me tell you something. If you've got arthritis, okay, in your feet, what a joke. What a joke. You're on drugs? Really? Are you kidding me? Okay, I'm going to need surgery? Are you kidding me? You're kidding me, right? I'm on painkillers? No, you need to get yourself and do one-shot therapy. Okay, so now I'm going to go in between. I'm going to put my fingers, see my fingers? I'm sticking my fingers in between my small toe and the next toe. And I'm going to hold, and I'm going to come in here and look at it. See, and I'm going to see how every time I come back, when I go forward, I just slide it. When I come back, I go in between, and there's no grinding. Do you want to know what's grinding? Because there's no crystals. There's no calcification been displaced in my bones because I take calcium ion therapy and I do IGF 300,000, so I don't have any osteopenia, any osteoporosis. You know, this is all just an illusion of somebody who follows the majority, seriously. So I'm going to come back here and I'll do the whole side of my foot. Look, look. And you're going to feel it. It's going to, for some of you, it's like this. This is what you're going to do as soon as you start. Oh, 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 oh. Okay, now, it's not your fault, but you've got victimitis. That's the only viral pandemic that I can tell, that I can see, is victimitis. And guess what? Did you ever notice something? That those people who run away from pain are always in pain? Oh, wait a minute. No, they're not, Daryl, because they're on drugs. And then they go on the drugs, and then they get the surgery, and then they get more drugs. And how are we doing? What a loop-de-loop. Okay? So when I do this, yes, it's painful, but I'm the master of my pain. I'm creating the pain. And when I get done with my feet after 20 minutes or a half an hour, I'm working on this foot, there'll be no pain. It will feel like the foot of a teenager, a healthy teenager again. But no, you go ahead, you complain, you explain, you make it up, you make it the responsibility of the practitioner or your medical doctor to numb you out or to do whatever you want to do. But the reality is this, you can reverse anything that's going on. Okay? All right, here we go. So you're going to go in here and look at the action. Look at this action I'm doing. And I'm going to do, I can do the whole top of my foot. But first I'm going to go in between every one of the lymph channels. And the lymph channels are in between your toes. And you'll follow them all the way back. So you can go in here and understand something. Don't rush it. So let's say today, all I did was the top of my foot. And I spent a half an hour, maybe 40 minutes on just, this guy's everywhere. Now he's over here. Okay, he's over there, he's over here. Anyways, so I want you to go slowly and thorough, and I want you to connect to your Lionheart breathing, and I want you to breathe. And even though it could be painful, guess what? Those of you that complain about the pain the most run away from it the most, and you're going to live with pain for the rest of your life. Did you ever see these pain management clinics? Well, forget that. I'm not going to manage my pain. I'm going to master it. If I've got any pain in my body, I can do one-shot therapy, whether it's here or whether it's here, or whether it's my elbow, I'm going to go in and break up that calcification, that scar tissue. I'm not going to sit there and take drugs or have that pain wear me down and change my personality so I'm not nice to myself or my family. Do you get this? The more pain they can put you in, the more that they can cause problems with you, with loving yourself, caring for yourself, and caring for your family. Remember, it's us against them. It's not me against you. It's not you against me. It's them against us. All right? So I'm going to go and I'm going to do all the lymph channels. Go very slow. Let me just do the one where the big toe is, and I'll show you how long I would take. Look. I found something right here. So I'm going to grind that out. I'm not moving. I am not going to continue to keep going until I break this up. Listen. I don't know if you can hear it. I can hear it from here. So I do have a knot in here, and I'm going to stay there. And guess what? I might stay there for 10 minutes and work this knot. Oh, but Dr. Wolf, I did it. The morning I got up, I had this big bruise. Do you think I'll get a blood clot and have a heart attack or die? Well, you might if you don't break this up. And understand something. The only people that bruise are people that are rotten, that they actually have their tissues rotting out. You do get that, right? You do understand that you don't have any pain in your body unless you have a physical block. You do understand that most people have pain in their body because the energy is trying to get past the block, but it can't. So you feel all that pressure like a headache. If you get rid of the block, okay, whether it's in your head, okay, whether it's in your knee or whether it's anywhere, then you're going to have flow. Where you have flow, you don't have pressure, you don't have pain. And that pressure is going to be displaced calcium, scar tissue, and crystallization, nothing else. Nothing else. If you were to get rid of every physical block in your body, you'd be young again. I'm telling you, you would go and you'd be so playful, you'd have so much energy, you would just love your life. I love my life. So we're going to come back here into the lymph channel. And we're going to break it up. Now look at what I do. You see how I move this? Look at the bottle. Look at the bottle. So I'm going to angle it 45 degrees that way, 45 degrees this way. I'll play with it. Look. I'm in between the channels, work the directions, get in there, do a really good clean out. Coming right back to what we call the horseshoe here. Oh, you see this here? Do you guys see this? Okay, here, this, when I was 32 years old, I went through a really stressful period, okay? And I was still trying to master my stress, but this was a different situation. I brought ozone therapy into my clinic, and then CBC came after me because I was working on HIV patients, and they did everything to try to destroy me. They set up across the street for like a whole week interviewing all my patients, trying to see if they could get one person to say that I made false promises. Anyways, so this is what you get, okay? I had eczema in this. I don't have eczema in my body, but eczema is just a little brother of psoriasis. So I actually got eczema here, okay, in this area from that stress. So see how the invisible becomes the physical? See how the psychological rules the biological? I'm going to tell you, I'm just a human being, and I'm still learning, and I want to stop burning, don't you? Okay, so now, let's say we went in and we did the lymph channels all the way, right? Just to open things up. Now, you can come in here, and you can do each joint in your toes. You really can. You know, close your eyes, because if you close your eyes and you go by feeling, not seeing, okay? Feeling is the way to go, and if you were to feel your way through life, you wouldn't get yourself into trouble so much, okay? And you want to feel your way, so just close your eyes, connect to the Lionheart breath, and go in here, and when you find a knot, just work with it. And go in here, and you've got little tendons and ligaments in between each joint. Don't be worried. Go right in there, okay? And grind out. So look at Dr. Wolf. I got a toe problem. I got one toe that's so in trouble. Then why aren't you going and even finding maybe a different bottle that is smaller bottom, maybe has even more of an edge. Why aren't you going in there and using my technique and going in there and decrystallizing and pulling the scar tissue apart to get the blood flow again? You would have your toe back. I hope you get this. You get your toe back. Either that or I'm going to call a tow truck. What should I do? Call a tow truck, or you're going to just take some massive personal action and get in there and start pulling that scar tissue apart? Seriously. Okay? So you can get into any of these, and don't be afraid. Go right on the side of your toe, and somebody says, could I use a crystal? Yeah, long as it's not too rounded, you do need an edge. So find the bottles at home that have a really good edge. And it doesn't even a rounded edge. But, make sure you use some coconut oil, and you don't, and if you have enough oil, and just keep digging in there and go different directions. Like if I did the side of my toe, I can go like this, move it a little bit. See? You see how I angle it 45 degrees both ways? And you're just going to go in there and you're going to work every part of your toe. So I'm going to go in and do the tops of my toes, the sides of my toe. Look it. You can get in there, look it. Get in there and do the sides of your toe. And go in between the joints, okay? And really get in there and loosen things up. Okay, so we've done all the toes, we've done the top. You want to make sure that you really go in, look at this. Really grind it, look at it. Like I'm putting pressure in here. And guess what? When you learn to work on yourself and that pain is a GPS, and I am the master. I am the master of my body. Nobody else is going to be the master of my body. And if I go to someone, I'm going to go there to be treated and trained so I can find out how to do this, so I can bring this home as a gift to my family. Okay? All right. So get in there, really work it. Back in this area, this is where you'll find reflexology, testicles for men, prostate, for women, ovaries, uterus. So this can be pretty tender, but look at how hard I can go. Guys, you can't go hard because guess what? You eat an inflammatory diet. You have an inflammatory mind where you believe all their bullshit, okay, about the end of the world. Okay? Me, I just mind my own business, and every day I stay in the present moment and I go, it's about me, it's about my dream, it's my passion. I want to go out and I want to find all the brave hearts in the world, and I want us to find our roar together. That's my passion. You couldn't get me off of that if you tried. Now, where's your focus? Where's your focus? Okay, so now we've done the top of the foot. Okay? Now I'm going to go here. This is where the horseshoe is. So remember what I said? Oh, before we go any further, this is called the lateral malleolus, this bump. Make sure you work all around it, okay? And really grind in there, in front of it. If you've ever had a sprain, here's where the problem is. Right in front of this lateral malleolus, okay? Right in here, this is called the medial. And right here, this is where you're going to have scar tissue and calcification. Let me tell you something. Every place you've ever had an injury, that injury is going to put you in a nursing home or give you a cane or a walker. So you need to understand, after surgery, after any injuries, after you heal, you got to go in and get rid of the displaced calcium that was in there to try to buffer down the inflammation so you didn't get mutation, and it was walling off the spreading of the inflammation. And then with inflammation, guess what? Just like frying a burger on a barbecue, you had dehydration of your tendons, ligaments, and muscles. So now they're like beef jerky. So we have to go in here and pull the fibers apart. So you see how I'm coming up on it? If I had it closer, you could hear the crunching. Because I dislocated both my ankles falling off a barn when I was younger. So now I'm going in here, using the bottle. Look at this. You see the 45 degree this way and this way movement? Well, you're going to do all these different directions, okay? I'm telling you, I've got enough stuff here that this is what I do. When I start the road trip again, like when I fly, I take my ankles apart and I take my knees apart. Okay, and guess what I'm going to do tomorrow? I'm going to come on here tomorrow and I'm going to show you how to do your knees. Would you like that? Well, I'm going to show you how to do your knees. It's going to take some practice, but you're going to be able to get this, okay? And you're going to be smarter, okay? And you're going to do better than 99% of the practitioners you go to out there, and I'm not putting them down. They just don't have this technique, okay? So now you go in here and you grind up against the malleolus. Understand, we use our bones to actually pull the tendons, the ligaments, and the crystallization and the calcification, the scar tissue formation. We use the bones as a backboard. And that's what I was doing with my toes. I was doing it with the lymph channels to do the whole top of my foot. I'm using the bones as a backboard to take everything apart. And because the bones are stronger than the crystallization and the displaced calcium, they're going to crumble for me. And don't let anybody give you any BS. You're not going to cause any blood clots. And if your foot goes black or blue or purple, don't worry about it. It just shows that you're rotten to the core. It means you've been pooping in your pelvis for years, okay, and you have so much infection inside of you. Healthy people don't bruise. You need to get that. And healthy people don't swell. I'm not going to swell, and if I swell, I'll swell a little bit because I've created some inflammation, but big deal. Okay, let me keep going. So I'm going to go in and use the malleolus bone, and I'm going to go in here, and I'm just going to bring everything up against it, and I'm going to break all this stuff up. I'm going to go in and do my whole heel, come around, I'm going to come up from all directions. I'll even come on top of the malleolus, and I'll make sure I break up everything. And guess what? Keep your mind occupied. Okay, if you're always focused on pain, you won't be able to do this because you'll be, oh. And if you're the type of person that sees things and you feel sorry for things in life, you'll never be able to do this either. Okay, that's the wrong attitude. Where's the brave heart? Come on, you can do this. If you can do this, you can show it. Show up for yourself and others. Okay, so here we go. So let's break all that up. Come around here. Really be thorough. You find something, you don't leave it. If I find that I got something here, if that takes me a half an hour, I'm going to stay here until I pull the whole. I'm going to keep working on this until that area feels brand new. There's no crystallization, there's no calcification, it doesn't feel like beef jerky, and it doesn't feel tight, and it doesn't feel weak. Because when you have perfect circulation, you've got strength, you've got tone, elasticity, and flexibility, and that's what you had when you were younger, okay? So now I can come back here, and I can work on the back of my heel. Look at. And I can come in the back and do this, or I can come up like this. Look. Come right up in here. All right? I worked on 2 people last week, and they had the size of, I'd say it was sticking out that far, big calcium scar tissue knot. And I had to use the bottle first. But first what I had to do was do Celsonic. So first what I did, believe it or not, I did 150 pulses on this with a Celsonic because I had to decalcify it and fracture it and then bring some electricity into the scar tissue. Then I used the bottle, and then I used my elbow, and then we got it down by about 1/3, 1/2. Okay, so understand, all that is scar tissue and calcification because this person really does not look after themselves. Okay, all right? So then you're going to come up around the malleolus and clean here, okay? And then we're going to come over to the other side, and we're going to do the same thing. Remember, we did the whole top of the foot. We're going to come back in here, come underneath, look. I just don't have anything here because I do it so often, right? I do have a little bit underneath the malleolus, so I'm going to take that and I'm going to pull that up and I'm going to grind that in. Now, I am telling you this, the pain that I'm feeling from this, most of you would go, oh, I'm not going to do this. There's something wrong here. And that's because you've been programmed that if you create any pain, you must be hurting yourself. Guess what? They just screwed you over. You did hear what I say, eh? Screwed you over? Got it. Okay. So just understand, a lot of you that have varicose veins in your feet, okay, and you have all those old dried up calluses are because you don't get enough essential fatty acids. The varicose veins are because you're constipated. I didn't say you didn't go to the washroom. I just said that guess what? Just because there's traffic coming into the city doesn't mean you haven't backed it up outside the city by 100 miles. And you're the type of person when you go to the washroom, a little bit more could have came out and you have to sit there. Me, I'll be out here and I'll go, whoa, Yeah, I can feel my peristalsis in my large intestine. It's telling me that I should start to head towards the toilet. I go there, I sit down on the toilet. It's not diarrhea. I sit there comfortably and go, okay, I'll put my feet up on the stool. Maybe, wouldn't you do that? Okay, it's more normal, more natural. And then guess what? I'll just sit there, have a smile. Within 20 seconds, it's already done. Okay, no diarrhea. Okay, comes out like a beautiful bowel movement. So understand that. All the varicose veins you have down here because you are pooping in your pelvis. Okay, and those varicose veins can go away if you'd like. And remember what I said about salt glows. You might want to do those. The sand scrubs, you might want to do those. And if you do this, you can work right over top of your varicose veins. They're not going to pop and you're not going to have a blood clot. My God, isn't it great to know that we hardly know anything about health and that we've been programmed not to touch ourselves and to leave it for the specialists that don't know anything about health either? Most of them don't. I'm not putting them down, but you tell me they do. Okay, so now once I've done this whole area and I've done the back of my foot and the whole top, I'm going to do the eye. Remember what I said before? This is called the eye of the ankle. And right here is the secret. So I could grab both here like this. I'm going to come up here, right in that hole, right in the middle here where your ankle is. I don't care who you are. Guess what? I was on with a beautiful lady. Her name is Sabrina. She's from California. Go take a look at it. And it was called, I think I said 3 ankle surgeries, okay? And go back and look at it. It was just yesterday or the day before. I can't remember. Life is so crazy busy. But here's the deal. She said, Dr. Wolf, guess what? They want me to have surgery because there's a bone growing right here. I said, there's no bone growing right there. I said, look at life, look at your body like a river. Now, if your body was a river, your ankle would be the river bend. Did you get that? The river bend. Now, where would the garbage settle? In the river bend. In a river, it'll settle in the bend. In the body, it settles in the bend, so crystallization and calcification. She had so much calcification in here, they told her there was a bone growing. So anyways, just want to say this. That medical doctor's programmed just like the rest of us, and no bone grows there. What he should have said is, guess what? You're so acidic from drinking alcohol and eating so much sugar in an inflammatory diet and also stressing out so much that you're pulling bone calcium from your bones, and because you're so stressed out and it's coming out so fast, it's heavier and it's actually building up in the bend in the river called your ankle. And the eye here is like in a river, wherever there's a hole, what does everything settle? At the lowest level. So in the hole. So she was creating calcium in her ankle. Go back and watch the video. I had her start doing this on the video yesterday, and guess what? She was almost in tears. She only did it for 3 minutes and she was already getting relief. Understand something, you are the practitioner you've been looking for. So now let's go in here, and I'm going to use both hands, and I'm going to dig. I'm going to dig into that hole, and I'm going to do like I said. See this, guys? Look, 45 degree, 45 degree. Let's call this a windshield washer technique, windshield wiper technique. And I'm going to go from this angle, and I'm going to go a little straighter. You see how I'm doing all the angles? You're going to clean that out. Okay, you go ahead and do that for 3, 4 minutes to 5 minutes. You're going to get up and your ankle's going to feel free. Okay, so I'm going to go in there and I'm going to open up the eye. I don't want you to rush this. Your subconscious will try to get you to be impatient because you're not worth the love, you're not worth the time, you're not worth the money. Do you want me to keep going? And the reality is you are only going to give yourself what you've been programmed to give yourself. So take a look at your body, take a look at your life, and ask yourself if your belief systems are working for you or against you. So once you get the eye done, that could take you 5 minutes, it could take you a half an hour. It's so calcified. Why do you think old people trip? They trip over their own feet. Hey, you tripped over your own feet, ha ha. Why do you think they fall? They trip over their feet because guess what? The ankle doesn't move freely. It doesn't move around. It's like a stump. Okay? Are you with me? Okay, so I'm going to go in here and I'm going to grind it, clean it out. Then I'm going to come and I'm going to do what we call the horseshoe. and I'm going to come and do the same thing all the way down to the bottom of this called the malleolus, down to the bottom of the lateral malleolus and down to the very bottom here where the medial malleolus is, and I'm going to clean out the golden horseshoe. And if you go in here, look at, and watch this. Look at this. If I had a little mic, you could hear some grinding. But I'm going to be, when I fly to Puerto Rico here in 3 weeks, I will be on the plane, and this is what I'll be doing. I'll be working on my ankles, working on my knees, and I'll work on my elbows as well. And I'm going to show you, how about this? Tomorrow, like I said, I'll show you how to do the knees tomorrow, okay? And remember something, the secrets lie in the joints, okay? Even practitioners don't know that, except a chiropractor would know it. But he keeps on trying to push your joint back into place, but he never worked on the scar tissue. And the problem is your tendons, your ligaments, and your muscles have shrank because of dehydration. So you keep going in there every week or two trying to get them to push the joint back into place, when all we had to do is go in there and pull the scar tissue apart, get rid of the displaced calcium, melt the crystallization, and guess what? You're not popping out anymore, are you? You're settling in. Okay. All right. So now, like I said, we're going to go and do this whole area. We're going to clean it up. See how we keep using the angles? Look at the angles. Look at this. And understand, I get it, guys. You're going to do this, and you're going to be so scared to do it because it's the first time. What if I break my ankle? What if I cause a blood clot? Oh my God, oh my God, oh my God. But it's not your fault. And guess what? Just keep doing it. Keep doing it. Now just know this, once you go in there and you work it hard and you break up a crystal, you break up the scar tissue, you break up this calcium deposit, it's going to be tender. You're not going to be able to work on it again. If you are healthy, you can work on it again no later than 5 days. If you're unhealthy, it could be 10 days, okay? And that's all got to do with circulation, right? Right? Okay, all right. So we're going to come and clean the whole area, and then we're going to do it again. We're going to come over here and do the whole horseshoe, okay? And now we've done the whole foot. I mean, you could go here and look at, you can grind all this out too. Look, you know how that hurts? It can feel really achy. Well, get in here, come on. And go in the arch of your heel, because that's where you need it the most. And go in the arch of the heel, and look at this. Look at this. Use your body weight and get in there. I don't have any crunching, guys. It's because I live on a plant-based keto diet. Plant-based keto diet. Do you get that? Oh yeah, that's the best diet in the world. Not macrobiotic, not vegetarian, not animal keto. I mean, guys, yeah. Anyways, that's what we teach in our perfect day consultations to everyone. We build that for them. Here we go. Look at this. I can do all the way down into the pad. Now you can get one of your loved ones to do the rest if you can't reach it. But look at this. Get in there, work it on the edge of the bottle, okay? Now, after I've done that, it's not over yet. It's not over. Now, before you do your feet, we have what's called the natural skin brush made out of cactus and the handle's made out of hemp. But it's made out of cactus, which is the best thing to brush. Before you do your work with the bottle work, with the one-shot therapy that I just showed you, you're going to go in and skin brush. You should be skin brushing your feet to get the circulation going, and then I want you, what you could do is use Epsom salts and do an Epsom salt scrub. Remember what I told you? So before you go to work on your foot, you're going to take the Epsom salts, wet it down to the consistency of wet sand. If you had 10 pounds of Epsom salts, you would take 1 pound of coconut oil, mix it all in. Now, if I go in and scrub my foot with this Epsom salts and coconut oil in the bathtub or in the shower, and then rinse it off, I've already got moisturizer in my tissues. Do you understand? So you can do that prior to working on it. So skin brush, then cocoa salt glow on your feet before you start. Now then I'm going to do that, and at the end of it, after I broke this all up, what do I want to do? Increase the circulation. So I'm going to do just 3 minutes on the bottom. Just do what you can handle. You'd be surprised in a couple of weeks, okay? In a couple of weeks, you'll be going as hard as this. And I'm going to tell you something. What do you think you're doing? I already told you that all your nerve endings end in your feet. Oh, I've got sore feet. Well, when you get home, sweetheart, clap your feet for 2 to 3 minutes and then put peppermint oil, about 10 drops on the bottom. You'll have no pain and you'll be like, oh my God, I love my life. Okay? All right, so we're going to clap the bottom of our feet. Then we're going to clap for 2 minutes the sides of our feet and on top. And it's a little more tender here because it's not as meaty, right? But listen how hard I'm going. So I'm going to clap here for, do it as long as you can, but eventually you'll do more because guess what happens when you run a new program? That pain is not your enemy. That pain is your friend. Oh, wait a minute here. My God, guess what? They pulled your pants down and they shoved those drugs into you, didn't they? Let me tell you something. Pain is your friend. It is the greatest gift from God. And I'm going to tell you why. Because wherever you feel pain in your body, if you allow me to teach you, I will show you how to go in and get rid of it. And wherever you have pain, that means that you're creating a physical block. And those physical blocks go all the way from scar tissue to calcification to crystallization to a tumor. And understand this. Every physical block is slowing your circulation down. And when we do that, we slow the oxygen to the cells. When we do that, if we do 35% or more slowing down of oxygen to a cell, it becomes a cancer cell. End of story. Get rid of the blocks. Okay? So understand, your body loves you and it's talking to you. When you have a little bit of pain or you have a lot of pain, when you have a lot of pain, that's because guess what? You ignore it. Because you don't love yourself. You run a hate program on a subconscious level and you don't even know it. There's no way that you would ever be in pain unless you disliked yourself. Because if you loved and cared for yourself, you would know how to look after yourself. You wouldn't be going and saying, well, I'm going to go see the doctor next week. I'm going to go get a treatment next week. You would become the treatment because you'd be trained on how to master that beautiful thing. So I'm going to do the other side as well. Look. And I'm going to clap until my foot feels so tingly and I know I've done the job, okay? I've really done the job. So if you actually took the time to do what I just showed you how to do with your feet, I don't care how crippled you are. Stop telling people you're crippled. Stop telling them how you're on drugs. Just take massive personal action and it's issues in the tissues. And guess what? I'm going to leave this with you. It's not your fault. It's not your fault, but it's your responsibility. I'm going to tell you something right now. People come to me and they say to me, Dr. Wolf, it's in God's hand if I heal. And guess what? I don't even want to work with those people. And I tell them if they're going to have that attitude, I don't want to work with them. I definitely don't want them giving me any money. No money. No money. Because guess what? It's teamwork that makes the dream work. Okay? Listen to me. I know who my creator is, but I know I need to take massive action each day, and I need to create a perfect day of gentle, baby-loving steps that care and love my body well. Let me tell you something, and you better get this, and you can take this to the bank. Did you know you're made out of 50 trillion cells and 500 trillion bacteria, and they're all alive? Did you know that every one of your cells had a spine and a brain, and it has emotion? And every time that you stress out, you create a thickening of the outer layer of the cell, which means you block your spirit. Did you know that? And I can prove it to you because every one of us has a cell print, like a fingerprint. And every time that you're scared about the paper tiger that has no teeth because they're trying to terrorize you because they tell you they're the authority over you, just know this, that you're putting a thickening on your cell and you're shutting down the oxygen, the nutrition from coming in and the toxins from going out. Don't fall for their game. So understand this. You clap yourself. Okay, so here we go. You can go check out DMSO at store.docofdetox.com. You can check out my clapper. You can find an eyedropper bottle somewhere in the house. Okay? If you want, I told you about the peppermint oil we have. $95 gets you a 4-ounce bottle of pure peppermint oil. Nobody sells it at that price. I know that. Nobody sells the 4-ounce price that I do, or even the smaller bottles. And all of my stuff is pure. And my alchemist, he's 83 years old, and he's been making my essential oils for 35 years, okay? And this is not a pitch, okay? Now, also, go watch Reverse the Irreversible in my library and find out that it's all BS. You didn't need the stent. You didn't need the rod, the screw, the bolt, okay? You didn't need all of that going on, whether it was in your ankle or whether it was in your spine. Also, I'd like you to go take a look at what's called the 4 pillars of the perfect day. Go take a look at a perfect day diet, our exercises, our nutrition, and our energy medicine stuff. Just look at it. Nobody wants you to buy anything, so don't worry. And then go into my library, and you're going to find master classes, lots of them. Okay, there's one called Braveheart Online Emotional Masterclass. I'm telling you, it's a 33-day class. Go in and do that 3 times and then tell me you're the same person. Let me see you do it once and tell me you're the same person. Understand something right now. Your personality is not who you truly are. There's a news flash. You are the 5 main people that were in your life from 0 to 7. That's who you are. That's what your personality is made from. And understand this, you better dig deep, and you better understand that 90% of your brain is your subconscious, and you need to go in there, because all it is a bloody computer. Your brain's not smart. It's just it's a chemical hormone factory, and it's a computer. And understand, whatever programs you put in, it's going to run. And understand something, some of those are going to run you down. Some of those are going to make you feel old. Some of those are going to make you believe that you actually can't do anything or heal from anything. Well, I think there's a totally different story going on here when you realize what created you, and that if you created something on an unconscious level, just think what would happen if you were conscious and you had some tools and strategies that were based on self-love and self-care. All right? So for those of you who think that this is only the beginning, go check my Braveheart Nation out, or BHN University, and find out that we can go from one-shot therapy for your foot all the way to teaching you how to get your doctorate in natural medicine or indigenous medicine. There's a feather in your cap. Let me tell you something. The world is awaiting for you to find your passion and purpose so it can be gifted. Okay? Have a beautiful day, everyone. Okay? I'm going to jump in the pool. Yeah, it's right behind me. I guess you can see it. And just know this, every day is a beautiful day when you have beliefs that are based on unconditional love for yourself and the world you live in. Take care.